A fracture is any break in a bone. Fractures may be named according to their severity, the shape or the size of the fracture line, or perhaps even the physician who first described these types of breaks. In some cases, a bone may fracture without visibly breaking, and that's what we call a stress fracture. So it's a series of microscopic fractures or cracks in a bone that form without any evidence of injury to any of the other tissues. In healthy adults, these stress fractures can result from repeated strenuous activities such as running or jumping or extreme exercises. They can also form because of disruptive diseases such as osteoporosis, where we're breaking down bone faster than we're rebuilding or laying down new bone. Of course, that makes the trabeculae very fragile and very prone to being fractured. But regardless what causes a bone fracture, the repair steps are the same. We begin with a reactive phase, which is the very first and early inflammatory phase. Then we have to repair the bone, so that's the reparative phase. We've got to build new fibrocartilaginous structures and then replace that with bone. And then we have to remodel that bone in the next phase, which is called bone remodeling. Easy enough, right? So let's look just briefly at each one of these. So in the reactive phase, again, this is an early inflammatory phase, so the blood vessels that cross the fracture are broken. Blood's going to leak from these torn vessels, and a mass of blood that clots forms what we usually call a hematoma. So this typically happens between 6 or 8 hours after the injury, and because the circulation of the blood stops where that fractured hematoma is forming, the bone cells in the nearby area are going to die. Swelling and inflammation then occurs because of the immune system responding to all these dead cells. And then, of course, there's extracellular debris as these dead cells are being broken down. So you got phagocytes, neutrophils, and macrophages that are going to come in. And osteoclasts, remember, osteoclasts break down bone. Osteoclasts are going to begin to remove the dead and damaged tissues. So all around this hematoma, you've got immune cells coming in. You've got osteoclasts starting to break down bone. This stage can last up to several weeks. The second phase is the reparative phase. So we've got to form a fibrocartilaginous sort of a callus or a swollen area around where we're laying down all this very, very thick fibrocartilage, and it's forming an area that we can later replace with bony tissue. So new blood vessels have to grow into that fractured area where the hematoma is, and the phagocytes start to clean up all the dead bone cells. New fibroblasts are going to come into the periosteum, invade that fracture site, and start to lay down collagen fibers. Chondroblasts, remember, chondri means cartilage, blast means builders. So chondroblasts begin to produce new fibrocartilage in that area, and this creates what's known as a fibrocartilaginous callus. It's just a mass of repair tissue made up of all of that collagen and cartilage that's going to sort of bridge the broken ends of the bones together. So this can take up to about 3 weeks. Now the second part of the reparative phase is when we're going to take that fibrocartilage and create bone instead. So in areas closest to the well vascularized or the healthy bone tissue, we're going to have new bone stem cells, those osteoprogenitor cells, develop into osteoblasts. Remember, your blast are your builders. So these are going to start producing spongy bone trabeculae. The trabeculae are going to join the living and the dead portions of the bone fragments and start to just create sort of a bony callus instead of that fibrocallus, as the fibrocartilaginous tissue is replaced by osseous or bone tissue. This can take up to 3 to 4 months. And then we have the final stage, which is the bone remodeling. So this is where the dead portions of the original fragments of the bone are going to be broken down completely by the osteoclast, and the calcium and the phosphates will be resorbed and recycled. The compact bone is going to replace some of that spongy bone along the outer edge or the periphery of the fracture, creating that strong outer covering again. And sometimes this area of the bone can create an even larger area. So you can see just a little bit of enlarged area right here. Depending on where that fracture is, you may have a very, very large projection of the bony tissue coming out there, sort of like an overdoing. So that's just evidence of that healed fracture. Okay, so now before we move into different types of fractures, I want to talk just for a moment about how treatment, or how these fractures may be treated. So what you do about a broken bone really depends on several things. How old the person is, what type of fracture it is, and what bones are broken. The ultimate goal of a fracture, treatment of a fracture, is to realign the bone fragments, to immobilize that area to make sure that realignment and healing can occur, and to restore the function of those bones once healing has occurred. So in order for bones to properly unite, the fractured ends have to be brought into alignment. This process is called reduction, and it's commonly done as a part of setting a fracture. You may hear it called setting the bones. So in a closed reduction, the fractured ends of the bone are brought into alignment by manual manipulation. The skin remains intact. So that simply means that the person treating this fracture uses their hands and pushes those bones back into alignment, or the fragments of those bones back into alignment, so that a cast can be put on to hold them immobile until healing occurs. In an open reduction, the fractured ends of the bones have to be brought back into alignment by a surgical procedure. So this is using an internal fixation, and sometimes screws and plates and rods and wires have to be inserted into the bony tissue to hold the broken pieces of the bone together. Either way, typically, whether it's closed or open reduction, and remember, reduction is just bringing those bony pieces back in line. So regardless which it is, most of the time those fractured bones are going to be surrounded by a cast, a sling, a splint, a bandage, or some type of device that will hold that bone immobile so that healing can occur. Alright, so let's look now at some of the more common types of fractures. An open fracture, such as you see here, where the humerus or upper arm is broken, this is called an open or compound fracture. In a compound fracture, the broken ends of the bone are going to stick through the skin. In a simple fracture, the bones don't stick through the skin. Comminuted is when the bone is broken into two or more fragments. So lots of little fragmented bony pieces, all broken. These are usually closed or simple fractures where the bone is not sticking out, but it can vary depending on which bone is broken and the extent of that. So lots of tiny little pieces in the break. Of course, and just to show you what you're looking at a drawing and then, of course, an x-ray of these different types of fractures. The next one we want to look briefly at is the green stick. So I want you to think here what green stick means. Think of a tree limb that is still very young and it's green, and you try to snap that limb and it just breaks partially through but not all the way, and you have to wiggle back and forth if you want to even try to break it completely through. Well, that's sort of the idea with the green stick fracture. So it's a partial bone break that doesn't extend all the way through the bone. These are more likely to happen in children because their bones are not fully ossified and they contain a lot more of the soft tissue still as a part of their bones as well. An impacted fracture is one where the fractured end of the bone is driven into the other part of the bone. For instance, if you jump off a house, then you may have impacted fractures in the bones of your lower leg, or the bones of your leg in your lower limb, I should have said. Alright, so we mentioned that sometimes fractures are named after the people that first described them, and here we see an example of that, and one is the Coley's fracture, which is a fracture of the distal end of the lateral forearm bone on the thumb side, and that's the radius. Okay, so that radius is broken there at the distal end where it is closest to the hand. And then a pot fracture, a fracture of the distal end of the lateral leg bone. Lateral meaning side, remember. So the fibula is lateral, LA and LA, silly memory trick. And then, of course, you may also have some injury with the medial bone, the tibia, as well.